Tuberculosis has been an important health hazard within the gold mining industry going back for more than a century. I'm Professor Gavin Churchard from the Aurum Institute for Health Research.
You could regard the mines almost like an incubator where TB and HIV seem to particularly come together to cause a particularly serious epidemic. So it's a situation which it's an unusually severe problem which then demands an unusual solution. My name's Alison Grant and I work at the London School of Hygiene and Tropical Medicine, and my role in Thibela TB is as a co-principal investigator.
Not everybody wants people to know that they have TB. My name is Flora Masabata Popane. I'm the project manager for the Thibela TB project within the Welkom region. They have a perception that if they have TB, people will treat them differently, like it's a disease of poverty.
TB is the leading cause of death in people with HIV. It's the biggest killer. So there's no intrinsic relationship, it's just that they've overlapped, intersected, and we call it a catastrophic collision of two epidemics. My name is Richard Chason. I'm a professor of medicine at Johns Hopkins University and professor of epidemiology and international health at Johns Hopkins Bloomberg School of Public Health. And I direct the Center for Tuberculosis Research at Johns Hopkins.
I think TB control is something which should concern everybody. Infectious diseases don't respect national boundaries. And I think particularly we've seen with drug-resistant TB, that's a problem that could affect anybody. We do need to be concerned about control of TB because unless we control TB globally, we can't control it locally.
What is driving it in the current era is a high prevalence of two powerful risk factors for tuberculosis, namely the lung disease that is as a result of the silica dust exposure that occurs within mining, and HIV.
Conventional approaches to controlling it weren't going to work, and we had to come up with new, bold, community-level interventions that would help reduce the burden of TB in areas with a HIV epidemic, and thus was born CREATE.
I was very eager to be part of the study that can maybe bring change to the TB disease in our country, within the mines.
Se bohlokwa haholo ho nna gore ke tsebe boemo ba ka hore jole ka ke le motho wa mme a sebetsa mokoting hona le mefuta e mengata ya marole ka mane ka mokoting, hona le TB e nngwe e phekolehang, hona le e nngwe e sa phekoleheng. Ke ka ho ke la ka fumana hore ke mpe ke ye lefapheng lena la Thibela.
Isoniazid is a very well-known drug. It's been used for 50 years in the treatment of TB and the prevention of TB, and generally it's pretty safe.
And it was developed in the 1950s and was used for the first time to prevent tuberculosis amongst the Eskimos in Alaska.
We're not interested in whether one of the treatments that we're studying, isoniazid, works to prevent TB. We know it does. That's not the question. The question is, if you give enough of it at a community level, will it reduce the incidence of TB in the community? That's the question.
There are 4 elements to the Thibela TB program. The first is strong community mobilization and branding, where we educate the entire population around tuberculosis, around the study, and the potential benefits of participating in the study. So it's mobilize, screen, treat, and prevent.
Our recruitment is based on getting them understand that there's a benefit to them, benefit to their families.
We had to find places where TB and HIV were a big problem, And we had to find places where we would have the ability to do studies that are really unprecedented at a community level, where the enrollment is not of an individual but of an entire community.
And if this works, if what we're doing works, it will actually help in changing the policies. So it will benefit even more people.
Ke la ka nahana ka tsela ene ne tjena na jwale ka ke sebetsa mining ho ka nna etsela ho ke tshwara ke TB and hona le TB e nngwe hape e tshwaetsang.
For the main part of the study, where we're offering people firstly screening for TB, and obviously if they have active TB, we are directing them towards TB treatment so that they can be cured, and then we're offering them preventive therapy if they don't have active TB.